We're joined now by Dr. Jon LaPook. Doctor, you are a practicing doctor. How much flu are you seeing day to day?
John, I'm seeing a ton of it, and some of my patients are really, really sick.
2 strains this time.
Yeah, and we know what they are. There's H3N2 and H1N1. The good news is those 2 strains are in fact covered in this year's vaccine. What we don't know is, have they changed? Have they mutated? Remember during COVID, the variants, the mutations? Well, viruses, when they divide, they mutate. So how well matched is the current vaccine to what's actually out there right now? On top of that, this year, only about 40% of adults have taken the vaccine. That compares to about the same number as last year, but it's a full 10 percentage points less than the season before the pandemic.
Is that why we're seeing so many flu cases?
Yeah, it could be. And this year, we're now seeing, the first time since the pandemic, deaths from flu are more than deaths from COVID. And in about 22 states, that's the case. And in some states, like California, deaths from flu are about twice the death rate from COVID.
Is this just a reminder? Flu is always with us, and sometimes it can be quite bad.
Yeah, it can be quite bad, and it goes up and down. In fact, the CDC says that every year, anywhere from 9 million to 40 million Americans get infected, and 6,000 to 50,000 people die. That's a ton of variation. This year so far, 24 million infections, 13,000 deaths, and these are preliminary statistics.
But you can still get the vaccination.
Still enough time. Flu season can go to May, as late as May, and it takes about 2 weeks for it to kick in.
Dr. Jon LaPook, thank you very much.